Today's presentation comes to you from Erin Swilling. Erin is the Executive Director of Parents Helping Parents in Wyoming. She holds a bachelor's from University of Wyoming, and she is the parent of a 17-year-old son who was diagnosed with a disability at the age of 20 months. In addition to being an advocate for her son, she has also been instrumental in her work in early childhood education and intervention. Erin has spent the last 23 years working with children and families with the belief that connecting them to their community and resources help build capacity and sustainability as a productive, successful citizen. Her commitment to supporting education, special education, and family engagement initiatives continue to grow. Erin is also the current chair of the Wyoming Advisory Panel for Students with Disabilities. Thank you, Erin, for joining us today, and please welcome Erin Swilling.
Good morning, everybody, and thank you for letting me join you and you joining us on a Friday morning. I am truly greatly honored and excited to be able to do this morning. I've had the opportunity to also do this presentation for our K-12 educators and families who participated. But in talking with WDE, we thought it would also be a good idea to kind of help narrow this information down and really speak specifically to our early childhood folks too. And for that reason alone, I'm super excited, as you could tell from a little bit about what Susan said. I got my start in early childhood and early intervention, and have been a home visitor and a kindergarten and a preschool teacher and administrator for many years. So I'm honored to be with you all and hopefully get to share some great information today. As Susan said, I encourage, and I think WDE does as well, questions at any time. So please feel free to put those in the chat as well. And we'll kind of get started with our slide this morning. Okay, and I guess I should say we're here today to talk about defining and understanding educational need. It's part of that eligibility process for the special education under IDEA, but sometimes that can be a little bit of a tricky beast. And so we're here to kind of help define a little bit more about what that might look like, how it should be interpreted, and what can be done then to support that educational need component within special education. So first, we're going to talk a little bit about FAPE. And if you've been in special education at all, that might be an acronym that's probably been thrown around or that you've heard. FAPE stands for Free Appropriate Public Education. And under IDEA, children with disabilities are entitled to FAPE. I like to say it's the vehicle really that drives IDEA and drives that special education piece. And it's meant to help and be designed to meet the unique needs and prepare students for further education, employment, and independent living. FAPE requires the local education agency, and that in this case is child development centers, local schools, and school districts. So whenever you hear that word LEA, that refers to the local school that is in charge of that child and that child's IEP. And it requires that LEA to provide special education and related services designed to meet the unique and individual needs of the students that's in conformity of their IEP. And so that's a lot of what does that really mean, right? Those are a lot of words, but what does that really mean and what does FAPE really look like? So we're going to dive a little bit more into that in the context of our conversation today. But one of the things I really want to highlight is this sentence up here where it talks about preparing kids for further education, employment, and independent living. And that might seem at our CDC level that may or may not necessarily apply to the support of special education in how we're going to help kids with IEPs. But what I really honestly truly love about child development centers is that for you guys, you are the first initial vehicle that drives special education. And so what I love is that you all have such amazing connections with families and get to help parents and guardians understand the process of special education and the process of their rights as parents. And so what I encourage all IEP teams to do, regardless of the age of the kiddo, is to really make sure that they know that FAPE and special education and the conformity of the IEP is around all of those things to help kids get ready in every capacity for education, employment, and future life skills. And that starts at an incredibly early age and should be built on foundationally year by year with all of those people that might be involved in that kiddo's education. But it can absolutely start at that 3-year-old, 4-year-old, and 5-year-old level too. Okay, so what is special education? This seems obvious, and I know that, but what I want to talk a little bit about that is special education is not a place. We know under IDEA, we have something called the least restrictive environment, so sometimes known as LRE. And within that, there's a continuum of placements that occur. Child development centers, like school districts, are tasked with having a conformity, or I'm sorry, a continuum of placements. But that doesn't mean that a kiddo should be taken out of one place and receive their special education in another place. What we want and what IDEA says is that we want the kiddo who is on an IEP and who is in need of special education to be able to receive those services in the place that is a typical environment and in the general education setting as much as possible. And we're going to dive a little bit more into that in a minute. But what the key factor is, it's not a place. Special education is a set of services. So those are things like how it's presented, what information is presented, and it's really to address the unique needs of the child specifically and how they learn related to their disability. Special education isn't separated from the academic content that students are supposed to learn for their grade. And I know I say that sometimes that's kind of hard to separate for our CDC folks because you're not a grade yet, right? You're preschool. But educational components, educational need, and appropriate development and curriculum is still need to be considered in the conformity of deciding what special education looks like. And we'll talk a little bit more about that too, but that I want to make sure you know that even though it says grade here, it really is meant, and I kept that on purpose to ensure that child development centers are also aware of kind of that obligation or responsibility of ensuring that it's not, special education is not separated and different than what would be happening in the typical classroom. So IDEA emphasizes that special education needs to ensure students with disabilities have access to the general curriculum. And in the case of CDCs, I wanted to kind of hone in on these two pieces a little bit. In the case of CDCs, the curriculum that a CDC should be using should be aligned with the Division for Early Childhood. Right now, our early learning guidelines and our early learning foundations, some CDCs I know use those. They're a fantastic set of resources and again, guidelines and principles. But right now, the ELGs and the ELFs are not aligned with DEC, the Division for Early Childhood. I know that they're working on it. I had a wonderful conversation with Becca Steinhoff, Sheila Riceley, and Nikki Baldwin, I know is involved in this too. So if you, I don't know if they're on, but if you're on, hi ladies. But that is being worked on. So at some point, the early learning guidelines and foundations will be aligned with the Division for Early Childhood. But currently, right now, it's up to our CDCs to ensure that the curriculum that's being used in the classroom is aligned with the Division for Early Childhood. And we want that to happen because then there are specific milestones and standards that are appropriate for each age and level of development that then goes back to this kind of defining specialized instruction, special education, and educational needs. And so that's why that's really crucial to ensure that CDCs really do have that foundation. Okay, so special education can consist of a couple of different things. It can be an individualized curriculum that's different from that of a same age non-disabled peer. And an example would be teaching a blind student how to read and write using Braille. It can be the same curriculum that's for non-disabled peers with adaptations or modifications made specifically for the student. We're all pretty familiar with those. So the supplementary aids and services section of the IEP would help, for example, providing a preschooler visual support, such as the daily schedule. That would be what we would call a accommodation, or a combination of these elements. So this is no news to you. I know special education can look a lot of different ways, and I know IEP teams are really creative in how that can look. And so we'll talk a little bit more about that as we go along, but just kind of having this mindset in your head that special education is defined by a place, or by a set of services. It's a broader scope of that information. Okay, so now we're going to kind of dive into the nitty gritty of how do you really determine that eligibility component. There's what we consider are two prongs of eligibility. And we'll talk a little bit more about why there's a kind of an extra piece to consider within these two prongs, but we'll get to that in a minute. So the first one's pretty easy. It's the presence of a disability. We need, as an IEP team, when eligibility is being determined, we need to determine, has there been a disability that is recognized under one of the federal categories of IDEA? Again, we'll talk about that in a minute. The second one, this is the one that gets a little bit tricky sometimes, is how or is the student's education being adversely affected? And here's the caveat for preschool, so for CDCs, or how the disability is adversely affecting the child's participation in appropriate activities. And again, that goes back to the importance of making sure that there is a curriculum and that the curriculum is aligned with the Division of Early Childhood, because we want those milestones to be appropriate, and that is how DEC helps define that process. And so being able to then interpret what is appropriate participation and what are appropriate activities, that's a little bit ambiguous. And depending on an IEP team's interpretation, people might have some differing views of that. So then going back to what is looking as developmentally appropriate is a good baseline of how to start answering some of those questions. Okay, we talked a little bit about this just on our last slide. I said 13 plus 1 because Wyoming has decided to add an extra one, and yay for us for being able to do that. There's 13 federal categories of eligibility under IDEA. We have also added a 14th one, which is the developmental delay category. Each state kind of gets to decide if that's a category that they want to add, and then come up with some kind of definition behind what the eligibility criteria might be like. So we'll look at that a little bit more in our next slide. But what's important to know is that just because a kiddo has a disability or has a diagnosis, it does still not necessarily mean, and they might meet that first prong where we can see that, it does not necessarily mean that they are a student that is in need of special education. So let's kind of move on and talk a little bit more about that. Here, I just wanted to kind of just hit on our categories. So I've got 14 listed. You'll see the third one down is our developmental delay. And for us, that means that in Wyoming, we've defined that a kiddo can be eligible under that category through the age of 9. Often for us in Wyoming, the DD category is kind of considered the category of last resort. And if you're familiar with that category at all, there's a reason for that, because they kind of have you rule out any other eligibility category that a kiddo might fit in first. And so that's kind of why it becomes the category of last resort, where a team might say, you know, we've got some concerns. We feel like we're meeting all these criteria, but they've not managed to kind of fit into these 13 that we've looked at first. So we now need to also look at the DD category. A couple things to kind of note just with our eligibility categories. You know, I think there's a couple that are often utilized in terms of what's recognized the most for students at the CDC level. Speech language is often a category that kiddos fall under. But what I really encourage IEP teams to do is to truly look at any category that might even be a consideration or a possibility. And I think we'll talk about this a little bit more, but I keep saying we're going to talk about stuff, and I want to make sure I don't forget it. So I'm going to throw a little bit here right now, which is part of that is when you have your IEP, and on the first page, there's those categories, or there's that kind of area that says primary, secondary, tertiary. I really, really, truly encourage IEP teams to use all of those categories or all of those areas if appropriate, especially you all at the CDC level. Again, you guys get to be kind of that first introduction to special education and the building of the IEP and the appropriate services that come with that. And of course, we know if a kiddo is going to move on to kindergarten with that IEP, then the school district takes that information and they're going to gather their own information and do their own evaluations if appropriate and all those kinds of things. But that's kind of the baseline information for a lot of that stuff. And so when you have those categories there, that really does help from my perspective and what we do, at least at the Parent Information Center, and I think with a family's perspective, to include all that information. So make sure that you're legitimately looking at all the categories. And if there's more than one that fits the needs of the kiddo and they meet those criteria, consider using all three or all two or whatever feels best to help indicate what other disability categories the kiddo might be eligible for. And I know that seems confusing because on one hand, we say once a kiddo is eligible for special education, the job of the IEP team is then to identify any other needs that a kiddo might have should be embedded, incorporated into the IEP. But there's some nuanced information to that we will talk about later that still the categories would help being defined and making sure that really the team is kind of conscientious about what is the best one. Is there more than one? Should we look at more and consider what else should be an option that we as a team should at least discuss? Okay, prong two, this is a little bit more of the trickier beast. So it's kind of that defining that educational need. So right now I just wanted to kind of give a definition of what educational need really is or what it looks like. And it's the instructional strategies, services, activities, and supports, and the accommodations and modifications required in order for the individual to be involved in and make progress in the general curriculum. And then the caveat for CDCs, for preschool children, how the disability adversely affects the child's participation in appropriate activities. So there's that extra piece to consider. We want that participation and access to the general curriculum. Is the disability adversely impacting or affecting that component? In addition, that consideration of what's that participation look like? Is their ability to participate in appropriate activities also being adversely impacted? Okay, and so that's where I thought that is still really great to me. And I know it's great to other people too, because I've had the opportunity to be at IEP meetings where there's been discussions about this for eligibility. And so I thought it would be helpful to kind of help define a little bit more what is participation in appropriate activities? How can we help define that a little bit more for us as a team when we're together? And so I kind of just took this directly, and you'll see the link down here at the bottom, but I thought it was a really nice description or definition of what age appropriate activities really mean and talking about that milestone piece. So age appropriate refers to developmental concepts that are deemed appropriate or inappropriate to a child's stage of development. And that we want to recognize, particularly at the preschool level, you guys, because I think this is so important. We know that kids at all ages develop differently, uniquely, and individually and independently. And we absolutely want to encourage and support that uniqueness and that learning and the idea that different skills come at different times. So that's important to recognize. But within that recognition, there are still some kind of expected milestones that should be met per each age and stage of development. And that's kind of what we're going to look at here is have the kiddos, have they mastered those developmental milestones and expectations for their age? So when we're looking at that participation in appropriate activities, that's some of the things we want to look
at. Erin, we have a question.
Okay.
It says, if a student is qualified under the DD category, can they also qualify for speech, or does that contradict the last resort qualifier? I ask because sometimes we get kids that transition from preschool into kindergarten under DD with a speech language qualification too.
I'm happy to answer that. Susan, do you or anybody from WDE want to share any thoughts or ideas about that first?
Go ahead. Go ahead.
Yeah, what I would say is, and I don't have the DD eligibility criteria form in front of me, so I'm working off memory, so let me just put that caveat out there. But what I would say is that yes, if a kiddo has met the eligibility criteria for the speech language eligibility category, then that would be one that they would need to consider as the primary. Because again, the DD category is, again, kind of why we say it's the category of last resort. It's because basically on that eligibility form, you will have had to have ruled out that they do not meet criteria for any other category first. So if the team has gone over the speech language eligibility category and feel like those have been met and answer yes, that would be the primary category that they should.
Perfect. Thank you, Erin.
Okay, you bet. Okay, so a little bit more of kind of that prong two, that adverse educational impact or participation in activities. Some courts have ruled that if a student can receive educational benefit, or for preschool children, participate in appropriate activities from the instruction and services that are taking place in the regular general education classroom with the general education curriculum, because I hesitated to put that in there because what I also want to make sure that we know is we want the kiddos to be in their least restrictive environment. So could they be receiving specialized instruction and education in their typical classroom with the general education curriculum? You bet. So that is certainly a caveat I want to make sure that we're saying is that there's a distinct difference between are they receiving benefit from the curriculum that's happening versus can they receive specialized instruction in their general education classroom? And yes to that. So word distinct kind of definition is can they and are they receiving benefit and equal and appropriate participation in activities within their general education classroom, within the general education curriculum, even with the presence of a disability? Then IDEA and the courts really actually have said then that is not necessarily a kiddo who is in need of specialized instruction, AKA special education. That's hard for educators, right? Because I firmly believe that everybody who's at the table as a related service provider, administrator, and educator absolutely are in it because they love kids, want to help kids, help them grow, develop, and be these amazing adults that they're going to grow into. So to be able to then say, gosh, we see that they have a need, and we know that they have a disability, sometimes that connect is really hard from that to them being able to say, but they don't need specialized education, special education instruction. And so what I guess I want to make sure that caveat is known is that that doesn't mean that that kiddo is just left with no supports or services. What a local education agency, so CDC, school, should do then is provide other ways to meet the needs of that child. And there can be lots of interventions, things like MTSS, so multi-tiered systems for support, PBIS, so positive behavior intervention supports, differentiated instruction, which I hope that all educators are just doing as part of that kind of component of being a teacher and recognizing that different kids learn different ways and need different approaches to learn the information. And then accommodations. And I know teachers are just fantastic about implementing accommodations specific to either just their class or individual kiddos without even necessarily realizing that they're doing it, but because teachers, especially at this child development center level, are so intuitive to knowing what their kiddos' needs are, they adjust and adapt accordingly. But all of those are benefits and ways that a kiddo who might have a disability but does not have that educational need component can still benefit. I'm not going to do a deep dive into MTSS and PBIS, well, any of those four right now. But what I would encourage is that if you all or anybody has questions about what does that really mean, what does that look like, how can we do that, certainly reach out to a variety of people, your local administrators at your child development center, BHD, WDE, certainly give us a call too. We can help. We have lots of information about that. But just know that I don't want there to be a message that says, oh gosh, kiddo, you don't have a need for specialized instruction, and so we're not going to help. That is the antithesis, I think, of ACDCs and certainly any messaging that education would want to have. So there's other structured interventions that could support that learning or those needs of those kiddos as well. Okay, so I've kind of hit on some words of specially designed instruction a few times. And I thought it would be beneficial if we actually kind of help define what is specially designed instruction. And so I kind of, you can see it's a direct quote from this website right here, actually. So I'll just let you click on it later if you want to. But really what I want you to kind of take away is that it's specially designed instruction is the element of adapting as appropriate to the needs of the child with a disability, the methodology, content, or delivery of instruction. There's a lot of extra language in there, but those to me are kind of the key words to take away what specially designed instruction is. So adapting as appropriate, the needs for an eligible child, that's unique, that's related to their disability, the content, methodology, or delivery of instruction. we're going to talk a little bit more of that as we kind of go through the rest of this, but it's the one thing I always kind of try and write down and keep in mind when we're talking about what does eligibility really mean and how is that going to impact the decisions that we're making as an IEP team, our goals, our accommodations, and all the other things that are kind of built into that. Okay, so kind of once we've defined those two prongs, it becomes up to the IEP team to determine eligibility. And again, that can be a tricky beast sometimes. There's no definition, and I don't know if we want one or not, honestly. Sometimes don't ask for what you don't really want, but sometimes you want it. There is no definition of what adverse effect or participation in appropriate activities means. IDEA doesn't define that. So that comes back to the IEP team to really look at. And so we know we have our 13 categories listed, or 14 for us, 14 categories listed, but we get to that prong 2, and then we have those decisions to make. And so when there's a team that is in question of kind of that second prong, here's a couple ideas or questions that I think might be helpful for a team to kind of look at together. And that would be what eligibility category does the kiddo best fit in? And we talked a little bit about the importance of that. What is considered to be a part of a child's education or appropriate developmental activities? And again, that's where we look at the curriculum, the developmental milestones, and really kind of get a sense of how is that kiddo operating? Is their disability impacting those things? And how and why are those things being impacted? And then what does adverse effect look like in real life? And so that's where we look at, and I'll use a kiddo with maybe a speech language impairment. That at this particular age is something that legitimately can be an impact. If that kiddo is trying to converse with or have communication with a peer, and the peer cannot understand them, or the kiddo cannot express or understand, right, receptive or expressive, understand that language piece. Is that a barrier to them being able to participate? Is that impacting adversely their education? Absolutely. And so that's an easy one, right? Because we know that is a clear-cut definition of why we would say, yeah, this kiddo needs some specialized instruction. Okay, so what should be considered before a CDC refuses to evaluate a student or said that there's not a need for special education? There should be some focus on what the student is able to participate in, what are appropriate activities, and if there's a screening that indicates any concerns. Other indicators are also incredibly important to look at, and those are things like parent reports, observations, teacher concerns, and an outside diagnosis from a physician, a psychologist, any of those kinds of professionals who might also have a knowledge of the child. That would be important to consider. And then also incredibly important, and again, really hard for our preschool age, because behavior, it's developmentally appropriate for some behaviors to still be seen, and then to have the team then decide, is that behavior developmentally appropriate for 3, 4, and 5? Right? Because impulse control is not fully developed yet at that age. We've got lots of things that are still kind of working on that brain up there. So then it's hard for the team to say, gosh, is that behavior appropriate for this age? Or even in light of the circumstances, knowing that some behavior is appropriate, is there behavior that is continuously getting in the way and not allowing them to appropriately participate in activities? And then is that educational component being impacted? And those are the questions that it's up to the team to still decide and determine. But it's important to look at behavior too, because that absolutely is considered part of the whole needs of the child. Okay, some other things to consider. Uniqueness of the kiddo's performance, whether or not the child's performance is different from their typically developing peers within the school or a community setting. And then the purpose of this information is to assist in determining if the concerns are related to the child's disability or not, right? Because that's what we really need to look at. Is the behavior or the function or the distinction of what's happening related to the disability or not? And those are ways that we can also look at those typically developing peers and look at some of those kind of cross community things to see, is this the norm, or is there more that we need to consider, and should there potentially be a comprehensive evaluation? Okay, so OSEP, so the Office of Special Education Programs, known as OSEP, has stated that a child's educational performance must be determined, on an individual basis. I think everybody who's involved in special education is pretty aware and appropriate with that, but should also include non-academics as well as academics. If you've not ever explored OSEP, the Office of Special Education Programs, shout out to them. They put some great guidance documents out, policy letters, their dear colleague letters. So there's a lot of great information that happens when an individual, often special education attorneys, but special ed directors, it can really be anybody, parents, have a question specifically around something related to IDEA, that they will write a question and send it to OSEP. And OSEP will take that question and then share a guidance information on their interpretation of what IDEA says about that particular question. And so it is a great resource for people who might be like, what is educational need? And again, let me help you know that IDEA does not define educational need, nor does OSEP, other in the sense of these words and verbiage that we're talking about here, the prongs, specially designed instruction, adverse impact, those are their definitions, but it's not defined more than that. But look up OSEP if you haven't and you have questions specifically. They're a really great guidance for questions that teams might have around things. Okay, so let's talk a little bit more about what the law says. We're going to look at our state Wyoming Chapter 7 rules. We're going to look at some federal laws, and we're going to look at some Supreme Court decisions. That always helps us kind of decide how we should move forward with the decisions that need to be made. Okay, so we are defined for our special education first under our Wyoming Chapter 7 rules. They are consistent with the CFR. So if you see CFR, that's Code of Federal Regulation. That's our IDEA language. So if you're ever Googling anything and you put in Code of Federal Regulation and you put in the number, it will come up with our IDEA language. So our Wyoming Chapter 7 rules, of course, align right now with our CFR, our Federal Code of Regulations under IDEA, that says to be eligible for special education and related services under IDEA, a child must meet the criteria for a disability category, and the ability must adversely affect the student's educational performance such that the student needs special education as defined in, and then we've got some other codes of federal regulation here, which we're going to go through. Okay, so let's talk a little bit about related services, because that is sometimes a little bit of a tricky also beast to understand. So the key thing I guess I want to kind of focus on first is related services are required to assist. Now, let me back it up a little bit. They're developmental, corrective, and other supportive services that are required to assist a child with a disability to benefit their special education. So I think we all typically know this. The related service comes after the eligibility process in determining that there is a need for specially designed instruction or special education. So once the team has decided that, then it's also up to the team to look at those general kind of related service components and say, what do we think this kiddo also needs to be able to benefit from this specialized instruction and special education? There's a whole list of them here, and most teams are pretty familiar with the typical ones: OT, PT, speech, transportation. But what I really encourage IEP teams to do is look at all of these, because it's actually a pretty comprehensive list, and not everything is even going to be listed on here. Social work services, that's another one that lots of IEP teams are pretty familiar with. But there's things like recreation, like therapeutic recreation, early identification and assessment of children and disabilities, so rehabilitation counseling, orientation and mobility services, medical services, nurse and health services that often gets overlooked for a variety of reasons, but something as a related service to consider. And I'm kind of diving deeper into this because we're going to talk a little bit more about related services and eligibility here in just a minute, and I want to make sure there's a really good distinction of what those related services can look like. Okay, so this also, oops, let me move up my picture a little bit. Okay, so this is more language directly from the Code of Federal Regulation, right? 300.8A. The top part is just our definition of all of our eligibility categories under IDEA. The the bottom two are what I want us to focus on. And kind of let's look at those highlighted areas first. So 2I, we're talking about related services. And here's what I'm going to read. If a child only needs a related service, but not special education, the child is not a child with a disability under this Code of Federal Regulation. So let me pin that for a minute. Then we're going to go down to the second one. So then we say, if the related service required by the child is considered special education rather than a related service, then the child is a child that meets the criteria and is a child who needs specially designed instruction and therefore meets the components of an IEP. I don't know if that is potentially confusing for you all, but I think that can be confusing. And so I wanted to talk a little bit about what that means, because we've got a couple categories under our 14 for us, under our 14, that could be a related service or is also one of our 14 categories. Speech language is a great example of that. So we might have a kiddo that is getting a related service of speech language. And that means that the team has decided that they need that service to help support, due to their disability, the need for specially designed instruction. However, we know, wait a minute, how did you guys decide, you think she needs special or speech language services, but we have this eligibility category over here. Why is she not over here in this, over in this eligibility category instead? And so that's that really important component, is look at those eligibility categories first. Did they meet the criteria for speech language? If they did not, then they are not a kiddo that is in need of special education under the speech language category. However, that might mean that they might have met another criteria or another category with that criteria, and they still need special education, not special education, I'm sorry. They still might need speech language services in relation as a related service. So that is also true. We've got orthopedic impairment as an eligibility category. We also have fine motor and gross motor as things to look at as a related service of PT and OT. So again, a confusion. Wait a minute, can a kiddo have a related service of PT and OT? Even though we have this orthopedic impairment category. So that's what they're talking about here. And I'll stop for a minute because Susan, I see that there might be a question.
Well, Heather asked if you could give an example of that, but I think you just did. So I just wanted to, Heather, if you could type in if those examples that Erin just gave were what you were looking for. Yep, she said that answered it. Thank you.
Okay, great. Yeah, that's why it's confusing, you guys, right? Because there still has to be that component of that special education piece. And so the related service gets to come afterwards, but it doesn't get to be the deciding factor of, does this kiddo need specialized instruction, unless they've met that criteria. That also makes us maybe worry, like, wait a minute, we know we have a kiddo that might need some PT or OT, but hasn't met the eligibility criteria for, I'll just say, orthopedic impairment. What does that mean? That means we still want to help, and what can we do? And we're going to talk a little bit about other options that are available in addition to those interventions that we talked a little bit about earlier. There's some other ways to support that kiddo's kind of need for additional support. Okay, and we've kind of hammered on this a little bit. I just want to make sure you know that this is also in the Code of Federal Regulation, that specially designed instruction is, of course, at no cost to the parent. That's part of that FAPE piece, that free appropriate public education. And it's designed to meet the unique needs of a child with a disability, including, here's the part why I wanted to include this, instruction conducted in the classroom, in the home, hospitals and institutions, and in other settings, and things like instruction and physical education. So that would be what schools would call adaptive PE. And that means that that kiddo needs special education, specially designed instruction, specific to this area, but also that it's important to note that that can happen in more than just a classroom setting. When we have kiddos with disabilities, we recognize that there might be some other needs that they have, where they might be spending larger parts of time in a hospital or a different setting to address those disabilities. And then is it the job of the IEP team, if appropriate and if agreed upon by all people involved appropriately, that some of that instruction should happen in other areas. And that's the job of the IEP team, to take all those things into consideration and figure out how to do that and do some outside of the box thinking when that is appropriate. Okay, we talked a little bit about this, and again, this example is gonna, it's more for school districts, but I thought it was still important in part because you guys, again, get to be that very first introduction and initiation for parents and students, potentially, of what special education and their rights and roles under the IEP should look like. And so I wanted to share this so you all have that foundational knowledge too. There was, in the main district court, there was a decision that was made that a kiddo who had a diagnosis of Asperger's syndrome, this kiddo did really well and got great grades. And so the school had decided that this was a kiddo that was not in need of special education. And there was no IEP or any services. And so the family disagreed and it went up to the court. And basically what the court's decision was is that even though their educational performance in terms of academics was spot on and doing very well, that there was also the consideration of life skills and behaviors that also needed to be considered so that that student could be successful in life after high school, but also high school life. And that the school did not take those things into consideration, and there was a need in that area. And so the school determined that, the courts determined that the school had not provided FAPE to the student because they only looked at that her education in terms of academics and not that whole functional kind of developmental piece of getting the student ready for post-employment life skills and that whole kind of whole needs of a child component that we talked a little bit earlier. Okay, so let me move this back up. Okay, so another OSEP letter. I love OSEP, if you guys can tell. I'm a little bit of there's a couple things I love about special education, and I think OSEP letters are actually kind of fun because they really do help. I think when there's some gray area, instead of having somebody have a bias or interpretation, going back to some of this information to help drive some decisions. But there's the OSEP policy letter back from quite a while ago, but it still stands, that determines that when determining a child's specific needs, the child must be assessed in all areas related to the suspected disability. And that includes, right, all of the health, vision, hearing, social, emotional, general intelligence, academic performance, communication, and motor. I think IEP teams are, as a whole, are pretty good, right? When teams give parents the consent, all those boxes are well, hopefully appropriately marked. But let me just put a caveat to that really it is IDEA's definition that any area that is suspected to be a disability or a need that is being impacted by a disability should be evaluated. And sometimes there's some barriers to that I absolutely want to recognize. Do we have the right assessments or evaluation tools? Sometimes we don't. Often we do, but not all the time. Are the appropriate people trained on how to administer the appropriate evaluations and assessment tools? And sometimes those are hiccups because if either or both of those are no, it potentially means that that student with a possible disability is not being fully evaluated in all areas of suspected need. And then we've kind of got that hiccup of, well, it's more than a hiccup. We've got kind of a pretty big barrier then in determining what is appropriate for that child. Are they a kiddo in need of special education? And how do you then develop and conform an IEP individual to that need if we've not been able to assess that? So this seems really obvious, and I know as a whole, IEP teams do a great job, but what I want to recognize is that don't let those barriers, because there are barriers to that, prevent this from happening. Instead, there's some solutions that we would want to be creative in thinking about how to kind of tackle those challenges, which we'll talk about. Okay, another one, my favorite OSEP memo. Not necessarily applicable to CDCs as much, but again, I want to make sure you all know this so you get to implement it as appropriate within your centers, but also to help parents know all of this, particularly if they might be transitioning to kindergarten on an IEP. There is a memo that came out that said basically a school cannot, well, I guess this is for kiddos who are not on an IEP really. A school cannot deny or delay evaluation due to the kiddo needing to go through the RTI or response to intervention process first. That if there is a concern or a suspected disability that the parent or the school might have, that it is the obligation then of the school to consider a comprehensive evaluation, and that the kiddo does not have to go through lots of interventions first before that decision is made. If there is a suspected disability on either end, that should be kind of looked at. We can go into that more later, but I think we've covered the basics for that right now. So then we kind of talk about, well, then that leads us to when is an appropriate time to consider a comprehensive evaluation. So we've got kind of 3 different areas to consider: child find, parent request, and then screenings that CDCs do, and what red flags are coming up from those screenings. So let's talk a little bit about child find. Child find is a federal mandate that says a school district, so in this case, Child Development Centers, as the LEA, are responsible for identifying, evaluating, and locating kiddos with suspected disabilities. And again, that's why you guys do all of your screenings. You often partner with preschools and daycares to be able to provide that screening process. So that's one of those ways that CDCs meet that child find mandate, is how are we in the community finding, right? That's that locating kiddos that might be a kiddo with a disability, and how are we going to help that process? So that's a child find definition right there. But it's important that CDCs continue to do that. One, it's a mandate, but 2, it's not the parent's obligation to seek out that help. Although I encourage parents to do that too. That's them being vested in the process. But that's what that child find is. It covers every kiddo from birth to 21. And again, it goes back to that piece of the school must evaluate anybody that has a suspected disability. So then let's move. Oh, wait a minute. Did I skip? Okay. To kind of help with that, I know we talked about parent request. You all certainly know that parents can also come to their local school, their local CDC, and consider requesting a comprehensive evaluation. Again, that child find mandate says that if there is a suspected disability, so maybe the parent's bringing in some outside information or an evaluation that occurred recently and said, gosh, my kiddo just got this diagnosis. I have some concerns. Would you be available, or could you do a comprehensive evaluation? It comes back to the school of choice to be able to then make that determination. Is, are you seeing things? Do you agree? Is there a suspected disability that might need to be looked at? If for some reason you all, as the school side of things, say, no, we do not see that we suspect a disability, make sure that you do a prior written notice. It is a right, because basically a prior written notice says that if anything that the school agrees upon or rejects in relation to special education or under that idea premise needs to be put in writing and given back to the parent as part of their procedural safeguards. So if a CDC or a school says, no, we are going to reject the idea of providing comprehensive evaluation right now, put that in a prior written notice and be very robust with your decisions as to why that is not going to happen right then. Little caveat I'm just throwing out there. Okay, so comprehensive evaluations, right? We know this. It's an essential beginning step of the evaluation process to determine a couple things. One, to see if the child is a child with a disability as defined by IDEA, to gather information that will help determine the child's educational needs, and then to guide decision-making about what's appropriate programming for that child and their unique needs related to their disability. Okay, so why should parents be involved? A comprehensive evaluation requires information be gathered from a variety of sources. So we certainly want to look at our standardized tools that are used, our standardized evaluation and assessment components. But IDEA also says that we should gather information from a variety of factors. Parents are experts in their children, and they might be experts in a different way than educators might be, but they're the experts in their children. And so we want to gather information from parents about what their concerns are, what their strengths are, what's working well, what they think might need to be addressed a little bit differently. We also want observations, teacher recommendations if that kiddo is somebody that might go to a preschool or a daycare someplace else, being able to do some observations, but also talk to the others that are involved in the day-to-day life of that child are all great resources to kind of gather information and help guide decisions about what should happen. Okay, so then we've got our eligibility meeting. Let's say the kiddo's gone through the evaluation process and now it's time to determine eligibility. We've got our required attendees, right? This is pretty typical. Parent or guardian, general education teacher, special education teacher, school administrator, professionals who evaluated the child, who can also interpret results of the evaluation or assessments that have been used, and then others who have knowledge of the child. Another caveat, because I know a lot of IEP teams may not know this, and I sympathize as a former teacher, so do know that I know that before I say this. All of those required people are actually required to stay for the entirety of the meeting. I know often for teachers, we might pull a sub in for a little bit, but then you kind of give your piece and your report, and then you got to go back to your classroom. Or you might be a related service provider who's here for that little bit, but then you've got 3 other kids you've got to give some services to. So you're going to give your part of the report and then you're going to head on out. If you are a required member of the team, it is actually under IDEA that says you are required to stay for the entirety of the meeting unless you get permission written, make sure it's written permission from the parent that you can be excused. It happens often, it happens a lot, depending on your role. Lots of parents are okay with that. But the more that you can communicate that, it helps parents build that relationship and that trust. But B, we want to make sure that on the school end, there's no procedural violations being done. And if somebody technically leaves the meeting early and they're a required member, it's a procedural violation. So we're at our eligibility meeting. We have all of our people. Who makes those decisions? Something to consider is it is a team decision, right? None of that information should be talked about and decided ahead of the eligibility meeting. If you're calling parents without a meeting to let them know, hey, we've decided this, they're not eligible, that's probably a concern because again, this should be a team decision and the information be reviewed together. Should the MDT team, you might have a different name for it, but the group of people who did all the evaluations, should they put all their information in and make the decision within their MDT report? Or is there appropriate for them to just list their results, their information, and their recommendations, and then as a group, when you have the eligibility meeting, make that determination together? And that's what should happen. There should be no decisions that A, don't involve parents, and B, that are decided as a one-off with just one person or 2 people. And that kind of goes here to that predetermination piece. If any school personnel have decided that that students' educational performance or for participation in appropriate activities have been made without the parents and without having an eligibility meeting, then that is predetermination, which is also considered a procedural violation of IDEA. So it's important that even though you can look at some of those evaluation scores, right, the Z scores and all those kinds of things that might tell you something, that's just one component of data. And we got to look at lots of data. And really, at the end of the day, it has to be a team decision to help interpret those needs and that decision on specialized instruction, special education. So you can have thoughts. You can even talk about, like, here's kind of what I'm thinking. But if you're going to put any kind of draft decision, make sure it's draft. If you're going to make a determination around eligibility, make sure that it is not decided ahead of time. That is incredibly important. Okay, so then we talk a little bit about kind of underqualifying and overqualifying. Whoops, sorry about that. So let's talk about underqualifying first. First, we go back to that child find obligation. If we have kiddos that are have been in our district, I'm in Laramie County, so I'll speak specific to Cheyenne right now. This isn't an example that's actually happening. I'm just using this as because it's here where I am. If we've got kiddos that are here in Laramie County and they have lived here their whole life and they have been through school starting at preschool level and then have gone to kindergarten, first grade, second grade, and there's been some suspected need. Maybe there's been lots of RTI, response to intervention with reading or math or socially with behavior that's consistently happening and getting in the way, and they're getting some office referrals and things like that. And there's a pattern of information in history. I would challenge that maybe the child find obligation has not necessarily been fully considered, because is that kiddo then a kiddo with a suspected disability? Absolutely could be. And so it becomes really the job of the local education agency to really look at all of that, ensure that those kiddos are being evaluated if there's that suspected need there. So there's that child find obligation. We want to make sure that we're qualifying kiddos, or at least evaluating kiddos that may need that extra help. If we don't do that, if we have kiddos that are slipping through the cracks or not getting the services that they need or not getting them until a lot later, then there's also that consideration of a denial of faith, which can be a pretty big beast, honestly. There are times that Supreme Court decisions have decided that, yes, this kiddo is somebody who now needs some compensatory education. So now school, you are responsible for backtracking and giving them extra and more supports because you did not do your due diligence when they were at this stage, and now we've got to catch them up. So there's that really important piece to consider for that underqualifying. On the other flip side, is there such a thing as overqualifying kiddos? And it does happen, right? Because it goes back to the definition of what is adverse impact or adverse effect on education, and then what is appropriately participating in activities. So there's some of that bias that comes into it too. Could we be overqualifying kiddos because we want to make sure that they get help? It happens. So something to consider, instead of feeling like they have to have that special education, that specially designed instruction that truly may not be appropriate for them, we want to consider things like the PBIS, those positive behavior supports, or that MTSS, that multi-tiered systems of support. I'm not going to go into it again now, but because it's its own thing and it's comprehensive, and I want to do a good job with that. But there's supports, right? That's what a school's obligated to do, is to consider how else can we help this kiddo that may not need specialized instruction, but that we as a school, as a CDC, can still support to help their development and their growing. On the other hand, the consideration of a 504 plan, I know at the CDC level that doesn't typically happen as much, but it's always an option, and it's an appropriate consideration and option for those kiddos who have a disability, but do not need specially designed instruction. And we're going to talk a little bit about 504 plans next. So 504 plan, there's a couple of things to consider. It must be that a student has to be determined to have a physical or mental impairment that substantially limits one or more major life activity, or have a record of such an impairment, or be regarded as having such an impairment. And there's a pretty long, exhaustive list. And sometimes when you hear, or when I hear, I guess I should say, let's see, where's the major life activity, that also is a bit ambiguous. But if you look up some 504 language, they actually do a really nice job of kind of defining that. So even things like asthma, anxiety, depression, it's a pretty exhaustive list. And if those things are impacting the ability to function throughout the day, those are all major life activities. So school, work, developmental growth with peer development, all of that is considered a life activity. And so if any of those things are being impacted by a disability, they meet the standard typically for a consideration of a 504 plan. 504s require that school districts still provide FAPE, free appropriate public education. So that's the nice thing, is that's what I was kind of alluding to earlier, that there's still some things in place for kiddos who have that need, that they still get FAPE, and you can still get related services are still appropriate and available if the 504 team decides that that is also what's in need to support that kiddo with a disability. So all of those related services that we talked about before, OT, PT, speech, all those things, related services can be a part of a kiddo's 504. So know that there's things in place, even if they're not eligible for an IEP. I had a phone call yesterday, great example. I have a parent who called yesterday, and their kiddo is actually on an IEP right now, but they're not happy. They're having some problems with the school, which is typically why they would call, but they have been told by somebody else that their kiddo should have a 504 and an IEP. And they were absolutely livid that the school was not considering both of those. And so I had asked them, I said, well, tell me a little bit about what your thoughts are between what is a 504 going to do that an IEP is not going to do. And so once she kind of delved into, in her mind, what somebody had told her about what was appropriate, we were able to kind of just share information about both of these supports for students. And there are some differences, right? IEPs are under idea. 504 is under the Rehabilitation Act and the 504 plan, kind of under the Office of Civil Rights. One is more around discrimination, one is more around specialized instruction, but both of them have some things around ensuring that there's free, appropriate public education, that related services are available. There's lots of differences too. So what I try and explain to parents is that a 504, everything that's in a 504 could be in an IEP, but everything that's in an IEP is not in a 504. And that's okay because they're designed differently for reasons. But what is really important about a 504 to know, in addition to that FAPE and in addition to the related services, is that it is really meant for students to be able to access the general education, just like we would want for IDEA, but to access that general education, but that accommodations are still available and should be embedded in the 504 plan to help that student with a disability be able to access and then be successful with the general education curriculum. So lots more about that, but what I hope that I guess that there's some takeaways from this is that a 504 plan is an option for students who may still need some supports, but that do not, the team does not find eligible for special education under IDEA. Okay, how are we doing on time? Okay, so kind of wanted to also put into that some outside of the box thinking, because I know that there's barriers, there's challenges to being on an IEP team, making some of those considerations, and I want to address a little bit of those. So we know the I in IEP is individual, right? We want to make sure that the plan that's in place and that's been developed for every kiddo is specific and unique to their needs. So if we have I'll just give an example. So if we've got all of our kiddos that are on an IEP and receiving speech, get 15 minutes twice a week, we would say that that's not individualized. That's become cookie cutter. This is how much time the speech person has. This is when I've got it in my schedule. I'm making this up, but like I'm only here 3 days a week as the SLP. And so I'm going to see I've got 30 kids on my caseload. I know you have more than that. 30 kids on your caseload. I'm going to do 15 minutes each. That becomes cookie cutter and not individualized. And so be very aware that whenever you're making a goal, but also then of course the related services and the service delivery that goes with that really is individualized, not to our schedules, not to our barriers, which is tricky and something that we need to acknowledge is out there, but that it is individualized to the kiddo and what their needs are. Other barriers that I think it's okay to say, because we know they're out there: lack of staff, related service providers in particular, particularly at the CDC level, are really, really hard to find, especially in our smaller communities. And so having to think outside the box about teletherapy, contracting with other folks out of the community and seeing that they'll drive in, working with your school district to see if there's any ability to kind of contract with anybody there. It's hard, and it's a barrier because we know that there's not enough for the need of what we've got. But we can't, unfortunately, IDEA says, it's not even me, it's IDEA that says we can't let those barriers not appropriately support the needs of the kiddo. We've got to be outside the box thinkers about how else are we going to support that learning and provide those services, even with these barriers in place. So we know lack of staff, funding can be a barrier, and resources. That's when I encourage you all, networking with each other, of course, see what other outside the box thinking other CDCs are doing, talk to BHD, talk to WDE, talk to your local administration at your school district with your SPED directors and others in your wheelhouse that might have some other ideas, because I think with lots of people doing outside the box thinking, there's opportunity to kind of at least narrow down the margin of some of these issues or concerns. Time constraints. Education's hard, you guys. Being in this world is hard, and it gets harder. And then you have COVID, and it's made triple the amount of hard that you guys as educators right now are working through. And then you've got caseloads and reports and writing, and then IEP meetings. And I always say this, and this is legitimately true, something has to go to the bottom. Everybody prioritizes what goes to the bottom, but making sure that you are aware of what is appropriate and still putting the right amount of time, energy, and services in place to be able to meet the needs of the student is an important criteria of the work that we do. Difficult parents. As somebody who's been at the Parent Center for several years now, we get parents often who have come to a place where there has been some kind of dissension or breakdown of communication is typically what happens. So I want to acknowledge difficult parents are hard. And when, as educators, because I've been on this side too, we feel like we've done everything and are trying so hard and working so incredibly difficult to meet their needs and communicate. And your heart and soul is in it, and it truly is. And we've got parents then who may not either be appreciating or acknowledging or experiencing that, and instead you're getting anger back. It's really, really difficult to be able then to A, communicate effectively, or B, even want to communicate at all. So do some outside of the box thinking about what are they really upset about? Is there some other way I can communicate? Am I saying really positive things about their kiddo too? Are they just now for the first time hearing some of these concerns and challenges? And it's just, right, you've got to reframe as a parent what you've always thought that your kiddo is to maybe readjusting some of those thoughts. But don't give up on difficult parents. Find others that might help communicate, find other ways to communicate, but keep at it. It's so important, you guys. And I think CDCs, you all just do a fantastic job of that as a whole. You truly, truly do. Recognizing that there's differing ideas and views from other IEP members. That's a hard one, you guys. And what I really encourage is that even if your view or idea or interpretation or data is telling you something different, it's so important. It's why it's an IEP team. It's that everybody should be collectively weighing in on information or ideas or knowledge. It's why you're experts and professionals in the area that you're in, and it's why you're sitting at the table. So even if it's differing than other people and you are in the minority, and I'm often in the minority, so I say this with the recognition that it is really hard to do, make sure that you are able to speak up and share that. And it still gets to be an IEP team decision. And that doesn't mean it's always going to be that somebody's going to then agree altogether, but it's important to be able to share that as unique professional that you are. Okay, so kind of to wrap up for a little bit, I wanted to kind of give some thoughts on how to have some unique perspectives and thoughts when you're at an IEP meeting. So if you guys have ever heard of DeBono's 6 thinking hats, this is kind of what that refers to. And in my next slide, there's a link to the video that certainly you guys can watch. I don't know if we'll watch it now, but it's like, I think 4 minutes or so. And in his video, what he encourages is that during a decision making, and so in our case, we're talking about specifically decision making at an IEP team, to individually, each person, wear each one of these hats for a couple minutes. So put on your blue hat and kind of think logically about the who, what, the when, the how is this going to happen. Then take that off and allow yourself to kind of put that and compartmentalize it, and then put on a different hat. So put on your yellow hat next and say like, okay, how are we going to do those things? And don't think about any other thing. Just think about how you can do the positives. We can collaborate. We can reach out here. I'm going to find some great ways that this is going to benefit us. Do that for a couple minutes, right? And so kind of consecutively take a minute or 2 or 3 for each of these hats. Put them on, allow that process to be thought of for a little bit, and then put them back together and kind of collectively make that decision. If you're going to do that, I would encourage some of that to happen prior to your meeting so you can come in with lots of ideas already kind of in place. If you're going to do that during an IEP, one of the things I would maybe suggest is that maybe have everybody on your team be familiar with what these hats are and what they mean, and assign each person a hat, or see if each person would volunteer to take a hat for a couple minutes and say, hey, you guys, you know what, we're going to do some really collective outside of the box thinking right now. Here's our challenges. Here's what we're trying to get to. How can we do this? And let everybody take a couple minutes. Think with specifically their kind of thought process related to their hat. Allow them to brainstorm and then share it as a team. You can have like flip paper, chart paper, whatever you want. Have somebody record some of that. But it's a really great way to not do that cookie cutter approach to IEPs. And it's also a great way to not let those barriers that we looked at our last slide stop the team from being able to figure out what can and should happen next. So I think it's a really positive way for A, to make it be a comprehensive team approach, and B, to really outside the box, for lack of a better word. So just a thought, because sometimes we kind of get stuck with the things that are really hard to do or that we can't do, or the things that we've always done. So this is what we're going to continue to do. But again, that an individual or an IEP means individualized, and it's our job and it's our role and it's our goal that we should all want to do to be able to really support that unique need of the kiddo, specifically for them. Okay, so what are some benefits to doing that? And some of the benefits are you get to view problems from new and unusual angles. You get to see all sides of a situation. You hopefully get to find some results that are going to work based on the conversations and all the hats that people put on. Look at the problems, the decisions, and the opportunities, and kind of systemically, what are we seeing that's a pattern, and how can we address these, not even specific to the IEP, but if you've done a couple IEPs and you put on your hats and every time the same kind of problems or decisions are coming up, then systemically or internally within your organization, is that something that you as a team and your administrators can also help break down or define or find some problem solving mechanisms to kind of address as well, right? Because once we know that that's an ongoing issue, how can we fix that instead of letting that be the barrier that's not going to let us move forward? And then hopefully it lets us all generate great ideas and solutions. You guys are educators. You have a million great ideas and solutions. So being able to share those, think about them, and be proactive in acting on them are all great benefits to, I think, that De Bono's 6 hats that we just talked about. Okay, let me, I'll stop here and just know that those are all of the resources that were utilized in the development of this training, this PowerPoint. And I will stop and just see if there's any other questions or if there's anything I should go back and give a little more detail to.
It doesn't look like anything, Erin.
Okay.
Well, I really want to thank you for your time today, Erin, and for sharing your expertise with us. What a great message. I know understanding educational need is a complex issue. And so thank you for breaking that down for us.